Welcome to the Lean Blog Podcast. Visit our website at www.leanblog.org. Now, here's your host, Mark Graban.
Hi, this is Mark Graban. This is episode 102 of the Lean Blog Podcast for November 1st, 2010. My guest is Ron Wince, the president and CEO of Guidon Performance Solutions, and we're going to be talking about his views on lean in healthcare and the impact of healthcare reform and the Affordable Care Act on the healthcare landscape. Now, part of his background, before founding Guidon, Ron held senior leadership positions in organizations including J.P. Morgan Chase, Freudenberg NOK, and Lear Corporation, and you may have seen him as an expert commentator on the Fox Business Network. If you look on YouTube, you can find Ron talking about different topics there. So I hope you enjoy the podcast. To find the blog post or to comment on this episode, go to leanblog.org/102. You can pass that link along to people who might want to find this episode, or I'd invite you to go to leanpodcast.org for all of the past episodes and go to leanblog.org to participate in the general discussion that we have every day. So as always, I want to thank you for listening. Well, again, our guest today is Ron Wince, the president and CEO of Guidon Performance Solutions. Thanks for being here, Ron.
Hi, Mark. Thanks for having me.
I was wondering if you could start by telling us about some of your career background, maybe including where you first got started with Lean personally, and talk a little bit about Guidon Performance Solutions.
Sure. I actually first got exposed to some of the basic principles around Lean when I was in the military. We had a TQL program, not a TQM, but the same principles, TQL program in the Navy soon after I graduated from the Naval Academy. And then after the Navy career was up, I ended up going to work for an automotive company, and we were practicing Lean as a way to improve operations and turn around a couple of sites that were underperforming. Eventually got into internal leadership of the Lean program, and then eventually operations, where I had a chance to leverage those from a leadership perspective. From there, I got into the consulting industry, working for a company called TBM Consulting Group, and working a lot with a group called Shingijutsu, where I continued to learn more. And then eventually got into the service sector when I got hired to join Bank One, eventually J.P. Morgan Chase, and worked on their program on an internal consulting group. And then we formed Guidon in about 2005. Myself and a couple of folks from J.P. Morgan decided that there was a niche that could be served for people who actually came from the service industry and knew how to apply Lean and the Six Sigma tools together in a pretty much non-traditional industrial environment. And so that led to the kind of the brainchild for Guidon, and we formed Guidon in 2005, and we partnered with TBM to become their service branch, and we've been going strong ever since.
And so when you include services, that includes a good proportion of Lean work in healthcare, correct?
Yeah, that's correct. It's probably around 30 or 40% of our revenue.
So from your perspective, what would you say are some of the big trends or issues related to Lean in healthcare today, looking at kind of the environment that hospitals and health systems are finding themselves in right now?
Yeah, initially, healthcare from a standpoint of adopting the tools from industry or from other industry verticals to improve quality and patient safety was a big part of the focus early on, and then eventually it moved into efficiency and cost improvement. Unfortunately, it's been somewhat tactical, but with the initial forays of these tools for the healthcare environment, with a big focus on clinical operations and transactional processes. The industry as it is has always had some type of pressure on revenue and reimbursement multiples, and so those things have continued to drive an interest in how do we become leaner and more efficient, and at the same time improve the experience from the patient's perspective and improve quality and safety, et cetera. So that's really where the original early drivers, it tended to be viewed, and I think it still is to some extent in healthcare, more of a tactical toolbox. There are some good examples of thought leaders that are doing it a little bit differently, but it continues to be used as a tool, much like business process reengineering or something along those lines.
And so do I hear you right that, is it fair to say today, compared to some early days, CEOs or senior leaders that are coming to you, are they asking, do I hear right that they're asking less about, or that they're focused more on the cost and revenue pressure today?
Well, there's certainly a big focus on that. Interestingly enough, there has been some additional interest in how do we change the culture as well. So there's been much more of what you would have seen in a traditional manufacturing environment around how do we become lean thinkers, adopt a lean culture. So you've seen some of that begin to happen. But again, the pressure from the cost side, especially from the reimbursement side, and declining patient populations and complexity with the need to electronify and introduce information technology tools such as EMR, and the need to understand processes because of that, amount before we layer on technology. And then with health reform coming along, there's been kind of a constant barrage of things on health industry leaders that have led them to either accelerate what they were doing, continue what they were doing if they were already doing it well, or in many cases we're starting to see some new adopters coming along where they've started to recognize that the approaches they were using in the past are not going to get them where they need to be in order to survive all the complexity and the turmoil that's going along in the health industry.
Yeah, and I'd like to come back to the topic of health reform, but I'm curious to hear more of your thoughts. You talk about tools to culture. It was a progression the manufacturing industry went through, it seems, different waves of, JIT or lean or TPS adoption, where it seemed like in early waves, people saw a limited tool set, then they saw a broader, maybe more holistic tool set. And then in the next wave, people realized that, hey, this is about, culture and management system. Is healthcare benefiting, do you think, from those earlier cycles where people are able to jump to the culture piece earlier? Or is it kind of a natural progression? Healthcare is going to have to just work through tools first and then discover on their own that this is really about culture?
Interestingly enough, culture has been a big topic in healthcare for a long time. There's a lot of people that focus on cultural transformation, what would normally be considered, cultural transformation consulting or executive coaching, that kind of thing. So culture is not a new topic. It's new for people to connect the dots and recognize that by engaging, everybody, the entire population in the improvement efforts, breaking down functional silos, which is a big problem in healthcare, and getting people to solve cross-functional end-to-end problems together. They're just now coming to the realization that there's some benefit in the lean approach to help accomplish that. So the healthcare culture piece is relatively new. I wouldn't say it's universal, but I would say some early adopters are starting to see that over the last couple of years. It still is relatively tactical and what I call hotspot focused, meaning we're using, kind of a toolbox to go fix a problem. But we're starting to see more of this focus on the cultural aspects of it as, some pretty smart people begin to recognize that there is some benefit of incorporating this within what they might have already started in the past around developing cultures, changing the way people interface with the patient and changing the human factor side of the business. So we're starting to see that lean brings a lot of that to the table that they hadn't thought of in the past.
Yeah, and would you be able to share any examples of some organizations that you think are sort of leading the way, or at least doing a good job with trying to focus on lean culture?
Yeah, and these aren't necessarily clients, but people that we know from the industry that we think are doing good. You read a lot about the Virginia Masons and the Theta Cares of the world, but there's some companies that are not known for their lean work, but have adopted it as a very robust toolbox. So the Cleveland Clinic's one, the Mayo Clinic's another one, SSM Healthcare in St. Louis, Trinity Healthcare up in Detroit. So they don't necessarily go out and do a lot of promoting what they're doing. They're just silently behind the scenes using the toolbox, incorporating it with what they were already doing, and then now the latest trend is to try and measure both the culture piece and the lean and Six Sigma toolbox up with their business intelligence, or how they measure outcomes, so that they can drive themselves to what I'll call, I guess, a Gen 3 of how they use the tools.
Yeah, and it's right. Yeah, you're right that I think a lot of organizations kind of keep what they're doing close to the vest. There's certainly, it's great that organizations like Virginia Mason and Theta Care have shared what they've done, because that's inspired a lot of other great improvement. But a lot of people just kind of keep quiet about it. So maybe I'll hit you with a question. I realize it's an unfair one because I get asked this. People ask, What percentage of hospitals and health systems in the United States are currently trying to implement lean?
It seems like everybody's saying they're doing lean. So the interesting thing, though, is as we attend conferences or as I do speaking engagements, the dialogue a couple of years ago was, oh, yeah, we did lean or we're doing lean. But when you really start to say, oh, really great, tell me about that, when you really peel back the layers of the onion, you find out that, again, it's been more of a tactical toolbox. So it somewhat was treated as a checkbox. And now I think we're starting to see where people are starting to go, you know what, we did lean, but we didn't do it well, and we've got to figure out how to do it better. So that's the latest trend, is that lots and lots of people invested money hiring people from industry, from banks, from automotive, from other manufacturing, brought them in and said, oh, we have a lean program now. But I think what they're recognizing now is that even though you might have a program, it might not be an effective program. So that's kind of the latest thing. Everybody's starting to say, you know what, we need to revisit how we do this and maybe find a better approach to it. And then, as you know, Mark, there tends to be always some part of the population that abandons the approach because they've recognized that they're not doing it well and they don't necessarily have the appetite to go do it even though the benefits are there.
Yeah, so I mean that's one reason I know it's an unfair question to say what percentage are doing lean. As you pointed to, the variation in, well, what does that mean that we're doing lean? That could mean, we did 5S in one department, or, we have a full-blown lean management system in place and really trying to make it an organization-wide initiative, tied to strategy the way, Virginia Mason has done. So there's a lot of variation there.
Right.
But I'm glad to hear you say, and I would tend to agree with you. I think 3 or 4 years ago, and tell me if you agree with this statement, that not everybody would say, well, yeah, we're doing that. A lot of people would have still said, what's that?
Yeah, I think when we first started getting into lean about 5.5 years ago, as we were coming out of Chase, one of our first clients was a healthcare, one of the large healthcare organizations. One of the things that we found was they actually had quality improvement and they had Six Sigma, but they didn't have lean. So lean was kind of new, and people looked at it as a less capable toolbox in many cases because they were, the culture of healthcare is that we like to do the diagnostic. We want to understand the patient. And so that Six Sigma toolbox lended itself very well to that. There was a process science that was very robust and easy to repeat, whereas lean tends to be much more around people. And it tends to be much more around observation, and not everything can be observed as easily. So about 4 or 5 years ago, you would have said, yeah, that's a manufacturing thing. I think what you're seeing now is people have started to see the evidence from those who do promote and even from those who don't promote their application of lean. And then the Joint Commission actually put out a book a couple of years ago and talked about lean. And then, of course, LEI is now promoting it. So I think what you're seeing is people are starting to see enough evidence, which is important in healthcare, that it's a proven toolbox, and so they're willing to take a little bit of a calculated risk to adopt lean when, in fact, in the past they might not have been able to or willing to.
Yeah. So maybe let's move back for the time, or for some of the time we have left, back to health reform, because, like you mentioned, hospitals for a long time have been under pressure for cost and revenue and reimbursements being cut. But now with the new the national conversation, if you will, and the laws being passed for health insurance reform, health reform, how do you see that impacting people's motivation or amount of time that they have for lean? I mean, do you see in general health reform helping provide urgency for this, or is health reform a distraction that's taking away important executive attention?
I think it's driving urgency, but only when people actually recognize the ability or the capabilities of using lean within their organization. If they haven't made the leap yet to understand where lean can be successful in helping them solve a lot of these complex problems, because it seems like such a common sense, applied common sense kind of toolbox, so people tend to dismiss it as not being robust enough to take on some problems. Where they have, it's really driven a lot of the sense of urgency that you hear about as one of the best practices around how you get lean going, is having a sense of urgency or create your own crisis. You hear that in a lot of different ways. The healthcare reform is driving that for a lot of them, and it's doing it in a couple of different ways. One, they're going to continue to have pressure to move or migrate patients from an inpatient setting to an outpatient setting. So that is a very different revenue model. And so when you do that, you begin to cut into what has been the core business for a lot of hospitals in particular in the past. So that's going to drive part of it. Second thing is the reimbursement rates are certainly going to go down. So that's going to continue to drive it. And then the third thing is, there's a lot more of a microscope now on the transparency issue. So being able to tell people what you're doing is going to require some process thinking. So how do we measure the outcomes more accurately? How do we align with what HHS or CMS is requiring or some other regulatory body? And then the last piece is there's that transparency is going to drive much more pressure on patient satisfaction, quality, safety, and that kind of thing. So it's going to be much more of a consumer education than what maybe we've been able to get in the past. So some of that's going to drive the sense of urgency to go figure out different ways of doing it, and that's going to drive the interest in the criticality of adopting tools like Lean. And then the final thing is there's a big push on EMRs and electronification. That's driving a lot more of a, we better figure out how we do this today so we can make it repeatable enough to go put it in an EMR system or an IT system. And so that's driving a lot of that with a lot of financial incentives at risk if they don't figure out how to do it. So Lean IT in particular, we're finding, is something that we get a lot of requests for because people are trying to figure out how do they do this fast enough so that they don't forego some of the benefits, the financial benefits that are available under the HITECH Act or under healthcare reform that help them offset the cost of an EMR system.
Well, so just to that EMR issue, and I know this will be familiar to the healthcare listeners, but to manufacturing listeners, might be fair to say there's a lot of parallels with a manufacturing company and an ERP system. Kind of the opportunity to not just automate existing processes or have the software dictate here's a quote unquote best practice process. Is it fair to say the hospitals are that more hospitals are looking at kind of an integrated process and software view of fixing the process, improving that using Lean to make sure then that the EMR fits best with that, or are they using Lean to take waste out of the general workflow of the EMR installation?
It's actually both. So we're working with a couple of large healthcare systems, multiple locations as well as small, both ambulatory and inpatient. And in most cases, their initial interest was how do we get the EMR put in. But then once they recognized that by applying some of the tools, they can still quickly take waste out and make the capital cost more attractive, then they certainly went that route. The one difference that I think you find between, and your parallel of ERP versus EMR is right on, but there is one difference that we've learned over time, is that the way that medicine is practiced at the patient-physician point of contact can vary heavily depending on the physician and their particular approach to dealing with a patient and the complexity of dealing with the individual and what their needs are. So there is some complexity that's not normally in an ERP system, which can be a pretty repeatable, we're going to build 600 cars today, and here's going to be the parts that are going to go into those cars, and it's pretty repeatable, and we do it the same way. For a hospital that might see 100 patients in a day or something like that, every one of those 100 patients is going to be different, and the physicians who see them are going to make different decisions. So the complexity of that also lends itself to saying, well, we're doing a little bit of what I call the Sesame Street exercise. Which of these things is not like the other? And the things that are the same, we should standardize and make repeatable. And the things that aren't the same, we should figure out how we do it the leanest and most efficient way while providing the highest quality of care and allow physicians to be able to practice medicine the best way that they can based on the individual's needs.
Yes, that's absolutely right. And Ron, it's really been good talking to you. I think we have time for one more question. Maybe I can convince you to come back in the future and we can delve into some of this in more detail. But I would like to ask maybe as some final thoughts, advice that you would give to a health system CEO or senior leadership team member about what their role needs to be in a healthcare system's lean transformation efforts.
Yeah, I think it's not unique to what the talk track was always around manufacturing. You have to have some crisis or some rallying point that you need to bring people together. But then you got to provide the leadership, and you have to have a top-down leadership, but bottom-up engagement. So, it's very similar to the same model. The complexity is that, you're not building a very repeatable business. So you're going to have to be much more engaged. In particular, you need to engage the people that know how to practice medicine best, which is the nurses and the docs, and get them engaged. So starting with those folks being involved very early on is going to have a big impact on your ability to be successful. You can certainly go look at supply chain, and you can look at transactional processes and things like that, and get some pretty dramatic improvement. But if you really want to change the experience of the patient and you want to improve quality and safety, you got to have coordinated leadership with the physicians and nurses as well as with the administration side of it. And that's probably been one of the things that over the last half dozen years or so that we've learned, that in order to be successful, you really have to engage a broader cross-section. It's not just the CEO level that's going to make this successful. It's going to be the chief medical officer and all the other department heads who head up the medical practices.
Okay, well, thanks, Ron. And again, our guest has been Ron Wince, the president and CEO of Guidon Performance Solutions. Ron, maybe if you can let listeners know where they can find Guidon online, and I think it's worth mentioning people that the virtual conference that you did, the Business Beyond Boundaries event, that's still available as an archive for a little while, correct?
Yeah, that's correct, and we actually had a couple of very good speakers. You can find that at guidonps.com. That's G as in George, U, I, D as in dog, O as Oscar, N as in Nancy, P as in Paul, S as in Sam, guidonps.com. And we had some great speakers. We had Newt Gingrich on there that talked about transformational leadership, and we had Dr. Campos from Children's National Medical Center who talked about lean in the lab, and then we had some folks from financial services and government in there as well, and very well attended, and we got some great feedback.
Well, good, and thank you for sharing that event. It's a free event for people to go and take a look at, and hopefully they'll take a look at your website. And without trying to put you on the spot too much, hopefully we'll be able to talk to you again here on the podcast.
Absolutely. Love to come back.
All right. Thanks, Ron.
All right. Thanks, Mark.
Thanks for listening. This has been the Lean Blog Podcast. For Lean news and commentary updated daily, visit www.leanblog.org. If you have any questions or comments about this podcast, email Mark at leanpodcast@gmail.com.